the drugs, skip the scalpel, relief now, relief now, feel it now, relief now, relief now, relief now, relief now, yeah, let's go.
Welcome to Relief Now Nation, patient education for drug-free, non-surgical pain relief. Ditch the drugs and skip the scalpel. Discover relief now.
Pain is not a life sentence. This is Relief Now Nation. This show is where real doctors will share real results with Class 4 or regenerative medical laser. I'm your host, Dr. Robert Hannapole, co-founder of Relief Now Laser Centers and the Laser Masters. Our motto is ditch the drugs and skip the scalpel. Today, I'm honored to have Dr. Darren Kreitman of South Florida. He is a chiropractor by license, and he has embraced Relief Now methods. Today, we're going to talk about the patients, about the results. But before we do, Dr. Darren, why don't you just tell us who you are, where you practice, and what type of patients are you helping every day?
Okay, first of all, Dr. Darren Kreitman, I've been in practice. This is my 25th year. I do practice in Broward County, which is the greater Fort Lauderdale area in South Florida. And we see a variety of patients in our office. And I was searching for a long time for a better way to practice where I could treat more people and help more people and do it more effectively and not be restricted to just chiropractic. And I found the Relief Now laser methods, thankfully.
That's great. So you're seeing patients now using what you tell me, laser and other regenerative medical technologies like Shockwave and non-surgical laser disc decompression. If we have any patients and potential patients listening today from all over the country, why don't you tell us a little bit about why you're using regenerative medical laser, the kind of results you're getting, maybe some patient stories, outcomes, things like that.
Sure. First of all, let's back up. For many years practicing as a chiropractor, predominantly I saw patients with headaches, neck pain, and back pain. And that primarily was probably 95% of my patients. And there wasn't a week that went by, probably in the first 20 years of my practice, where someone said, can you help me with a knee? Can you help me with an ankle, maybe even a shoulder? And I was very, very limited within the scope of chiropractic in my ability to help those patients. And then I was introduced to the laser methods and the Relief Now model. And truthfully, my office exploded. Suddenly I was able to treat the whole patient, not just be limited to the neck and low back. And thankfully today in our office, there isn't a day that goes by where we don't help a patient get better with any ailments of the joints, whether it's the shoulder working its way down to the knee, the foot, the ankle, plantar fasciitis, and it's been fantastic, thankfully.
I know you told me you have a recent plantar fasciitis patient. For those of you that don't know, that is typically heel pain. And you were telling me that you have a recent plantar fasciitis patient that I think it was like after like 3 treatments, is doing a lot better. But you want to, talk about that and then talk really about the technology. Let people know, like, what is regenerative medical laser? How does it affect the body? How did it affect that patient with foot pain?
Sure. First of all, so sorry.
That's okay.
Um,
You're
there
good.
you go.
We see
I
you fine.
apologize. Okay, I apologize. I had a call coming in. First of all, we had a patient recently, actually just this week, who presented to me. And before I started with the third session, typical question was, how are you responding to your care now that we've seen you twice? Because we always like to ask the patient, what's going on? What's better? What changes have you noticed since you began treatment in our office? Because we like to keep detailed records on each patient's progress. And this patient came to us just the other day and stated that after 2 visits, actually, Dr. Hannapole, not 3, that she's actually noticed about a 60% improvement in her overall discomfort, and that she's able to walk now more than 1 or 2 minutes when walking
Wow.
her dog without that pain. So the results speak for themselves, and there's no question that healing through energy and not chemistry is without question the way to go.
That's amazing. Could you speak to that a little bit more about healing with energy rather than chemistry?
Sure. Deep tissue laser therapy, or class 4 laser therapy as it's commonly called, uses joules, which is how we calculate the amount of energy that is being emitted from a laser. And it's been proven that when this energy is implemented effectively into the body at the area of pain or inflammation, you're actually able to help the body restore itself back to its pre-injury condition, meaning you're reducing inflammation, thus getting rid of pain, opening up the ability to increase range of motion, and down the road, get the patient back on their feet or getting back to using that joint the way they did pre-injury. And the results speak for themselves.
So, if you were speaking to, again, a potential patient right now, and they really wanted to understand, like, what do you mean? What is laser? How is it? Is it like we hear all the time? Is it like those LED therapy or those wraps, or
Yeah,
what actually is it, and how is it going to help the patient, and how can it help them to avoid, the injections and the
sure.
pharmaceuticals and surgery?
Sure. Well, we all know the side effects of medication when it's abused. We also know the long-term effects possibly when someone has repeated injections into an area and often not getting the right results. And then subsequently, many patients come to us and they feel like their only last resort is surgery, which is just not the case. There's so many other ways to treat something because, as our motto speaks, ditch the drug, skip the scalpel is our goal. And the easy way to really explain the laser that I find effective with patients is we all know that plants, they grow with the help of the energy that's emitted from the sun, which is a form of regenerative medicine
Photosynthesis.
or photosynthesis when you learn that in biology in high school. Well, it's basically the same way. Medical grade lasers emit energy, much like the sun does, at a different joules, which is the amount of energy emitted, that is calibrated by the machine in an FDA cleared machine, and it goes into the body, and that body stores that energy for a specific amount of time. And when you constantly build on that, the body is continuing to add to that energy, and thus you're reducing inflammation, getting rid of the pain, and you're allowing the body to heal itself naturally, where you're not resorting to medications, injections, and unfortunately some patients do go down the surgical route. It actually reminds me, we had a patient this week in our office who canceled his back surgery and one of the reasons why is because he's already noticing less pain, and that's after one visit in our office using class 4 deep tissue laser.
Yeah, and you said that was using the class 4 laser, or as we like to term it, regenerative medical laser.
Sure.
And I think you mentioned to me prior to the show that he was also receiving the non-surgical laser disc decompression, which is a federally registered trademark for Relief Now laser centers. And that combination of the decompression and the laser is really what he was able to, why he was able to cancel the surgery, correct?
Yeah, 100%. We see patients all the time that are or were chiropractic patients, but let's be honest, some patients do not get the results that they were hopeful for. And over the years, we've been able to implement the Relief Now Laser Methods Laser Disc Decompression program. And what we do is we take a deep look into the MRI. We take a deep look through the evaluation of what their symptoms are, what the case history is, and then if the patient actually qualifies for our laser disc decompression program, we prescribe a very detailed, orientated treatment protocol for them where we use spinal disc decompression, and we use the regenerative laser methods to help heal that patient and get them back on their feet. And like I said, we had a patient this week who, after one visit, canceled his surgery. And I might
That's
add,
almost miraculous. That's really amazing.
well,
Uh,
what's even more miraculous is yesterday, just yesterday, we had a gentleman come into us. This guy was desperate. When I mean desperate, he already had the surgery scheduled. His third time having this same surgery schedule, and for whatever reason, the first time it was canceled, the second time was canceled. This patient actually was in the hospital gown, in the hospital, waiting for the nurse to take his blood. And guess what? The nurse came in and said there was a problem with qualifying you for your surgery.
Wow.
This patient panicked because he was overcome with the fear of what his medical bills might be. And he felt like it was a sign from God that something was telling him, do not go through this surgery. He
It
got on
sounds like it, right? Divine intervention.
Exactly. He got on the internet, did some Google research, found the Relief Now laser methods in Plantation, Florida, came into our office, and he was very honest. He told us, listen, I've been scheduled for the same surgery 3 times. My back has been hurting for over 2 years, and I'm scared of getting cut. Can you help me? And we sat down, we spent about an hour and a half, believe it or not, reviewing his MRI, giving him a thorough exam. We said, we can't make promises, but what we can guarantee is you'll be better down the road than surgery. Because again, as we know, surgery doesn't always have a positive outcome.
I, right,
And this,
right. I mean, listen, you can't ever really guarantee results, right? But
right.
I'm sure you give your absolute
Yeah.
110% effort
So this
to help
patient
the
actually,
patients.
so when this patient told us the story yesterday, we said, well, how did you do after your first visit? And Dr. Hannipol, what was incredible is he said, well, I was able to go throughout my day today. And I just noticed that I was able to go longer into my day without the pain. I was
Right.
able to get out of my car and not reach for my back. The burning that's going down his right thigh, he said, although it was there, he goes, it didn't come on until 3, 4 in the afternoon instead of at 9 o'clock in the morning when he's just starting this day. And these are the type of patients that make it uh, so great to be part of the Relief Now laser methods because we know that we're doing the right thing and we are getting patients to ditch the drugs and skip the scalpel.
No, that's awesome. Now, listen, you
Yeah,
mentioned
it's really
earlier,
rewarding.
yeah, I know it is. We personally experience it, and that's why we've created this network for patients all over the country. You did mention earlier about use an analogy about the sun, and we talked about photosynthesis. We know if we're in the sun, there are some really healthy wavelengths of light, but there are also some unhealthy wavelengths of light, like ultraviolet. So, just to explain to people, the safety of regenerative medical laser, what type of wavelength, what kind of spectrum are they, all stimulative? Are any of them destructive? Let's just get into that a little bit.
Well, first of all, let's say there are no side effects of deep tissue laser therapy. And the wavelengths that we use, as well as the wattage or power that's emitted from it, is all monitored through the laser. But of course, through the laser machine, of course, we could adjust it if necessary. And we take into account things like the size of the patient, the skin tone of the patient, if they have darker skin or lighter skin. Of course, we have to monitor if the patient possibly has a lot of tattoos because things like that we have to be leery of or be careful of, and maybe even change some of the numbers to accommodate that patient. What was your other question, Dr. Hannipol, regarding
Well,
that?
again, because I know that people hear laser and they think of cutting and
Yeah.
cauterizing and
So
surgery and destroying tissue,
yeah.
but
So
laser is biostimulative, right? It's not biodestructive.
there's nothing destructive about the laser whatsoever. And it's funny you say that because about once a week we get a patient that goes, a laser, is that like what they do in the eyes or where they're going to burn something off? And we have to kind of back up and say, no, all the patient feels is heat. And they say, well, is it going to burn? Again, the answer to that is no. And most of our patients, I'd probably say I'd say 50% of our patients say that they notice a soothing effect. It's almost like when you get in like a hot steam bath, you tend to be relaxed. And it's not uncommon for many of our patients to fall asleep during the laser because it is so relaxing and soothing from the heat. There is no cutting whatsoever. Again, it does penetrate deep into the skin and hit specific areas of the cell tissue that will help with the inflammation and pain. But there is nothing destructive about the class 4 laser whatsoever or regenerative medical laser.
Great. So you mentioned earlier about it's a dosage, right? But if it feels warm and soothing, how do you explain to the patient that, because I'm sure some patients feel that, wow, this just feels like like a jacuzzi, or it feels like a nice, warm, soothing feeling and relaxing my muscles. How do you explain to the patient that it's not, you don't want to give them too much energy if it's based upon a dosage, right? So how do you bridge that gap with, okay, they're starting to feel good, I mean, how long does that average session take? And are there any other therapeutic treatments or anything that you will provide afterwards or before to maybe continue just with that therapeutic part of it?
Sure. Well, different therapies for different patients for different reasons, first of all. So we can't group every patient into the exact same bucket of how we would treat them. But the average patient is under laser anywhere from 10 to 15 minutes, depending on what is necessary. Because again, when we prescribe treatment to a patient, we look at each patient as an individual. Just because one patient has plantar fasciitis doesn't mean we necessarily treat every patient with the exact same time. We really try to take into account that each patient is an individual, and we pride ourselves of that in our office of treating each patient individually. We may do shockwave or some other modalities or therapies if the patient needs it. We also do discuss home remedies that they could add to their treatment protocol that could aid the patient when they're home. As far as the dosage that we do with patients, we try to do what we call the minimally effective dose on each patient. And we try to get the patient to kind of understand that each visit builds on the next. It's kind of like, you could probably help me out with this, Dr. Hannipol, but it's almost like charging your battery. You don't need to charge your cell phone over 100% because plugging it into your wall more than 100% does not suddenly give you 101% or 102%, et cetera. So we want to build on each one, but it doesn't mean that the longer the therapy session, the better the treatment is. It's actually the contrary to that.
Sounds like you help a lot of patients that have tried a lot of other things, right? They've tried the drug pharmaceutical route. They may have had injections. Some patients may have even had surgery. But what would you say to someone who has really completely given up hope?
Well, if I were talking to any patient that gave up hope, the first thing I would say is do not give up hope because the reality is that already creates a mindset that there's nothing that could help you. And our job is to tell you there is. And we practice the Relief Now Laser Methods model of giving that patient hope. And what I would tell the patient is if you've tried 6 things and maybe they didn't work, well, we're glad you're here to try the 7th thing. And we're pretty darn confident in the way we practice that we can help you. And there is nothing more rewarding when a patient kind of walks in our office and says, I've tried 6 things and I'm leery, but I know I have nothing to lose because I don't want to go into surgery. And then suddenly they get better. So sometimes those patients that have actually given up hope, but still walk through our front door, those actually are the patients we want because we know that we could help them. And then they're going to turn around and, of course, tell all their family, friends, and loved ones and people that they care about that we were able to help them. We wish we got to them sooner than being maybe their 7th choice, but nonetheless, we're happy they're here. And there's nothing more rewarding than having a patient walk in and go, you know what? I could put on my sneakers now. I could go walking, or I could sit at my desk all day and my back doesn't hurt, or that numbness or tingling going down the leg to the foot is only 20% compared to where it was 100% 3 weeks ago.
How about getting, patients to do other things that they love to do, like playing golf, tennis, pickleball, playing with their
Yeah.
grandchildren? I mean,
So,
it's
so
about
one of the things,
transforming lives, right?
sure. So one of the things we started doing in our office is we asked patients, what is your pain, whether it's plantar fasciitis, back pain, numbness in the hands, whatever it may be. What is it stopping you from doing? And, patients say, hey, I can't golf anymore because of my knee. I had to give up pickleball because of my plantar fasciitis, or I had to give up another sport because of my tennis elbow. Or, you know what, my shoulder hurts so bad, I can't even pick up my grandkids. And those are the patients that you feel bad for them because they're not living their life on their terms. They're living their life, let's just say less than 100% due to that pain. So we tell them we're here to help you. These are our professional recommendations. And, let's get you started immediately on a way to better health and ditching the drugs, skipping the scalpel, and possibly for some, thankfully, canceling the surgery. And there's nothing more gratifying than seeing a patient get back to doing what they love that they couldn't do before.
Sounds like you're on a real mission. Sounds like you're on a real mission and that you really love what you're doing in terms of helping patients to transform their lives.
Well, I do love it. I love treating the patients, but even from a professional standpoint, eliminating the patients in this conversation, I love that I'm confident enough to be able to treat every patient, not just a neck patient, not just a back patient, but I could treat every patient that has a joint pain or a problem. And for many years, the wife sat in the chair next to her husband, who's the patient, and I'm treating the husband for the back pain. And the wife casually would say, I got plantar fasciitis. Can you help with that? And I had to say no. So imagine for 20 years, I said no to the spouse. And now for the past 5, 6 years, I'm saying, absolutely, I could help you, Mr. or Mrs. So and so, with that plantar fasciitis, or with that chronic knee pain, or with that shoulder ailment, or that tennis elbow. So, from a professional standpoint, it's the greatest thing we brought into the office on how to treat patients. And then, from a patient standpoint, it's great because we're helping them get their lives back together.
That's great. It sounds like almost you've been doing this for so long, but almost like a rebirth, for you professionally to help so
You
many more
actually
patients.
You actually just took the words out of my mouth. I was going to say, I feel like in the past 5 or 6 years, I have a rebirth because I'm now able to treat more people and I'm able to do it effectively and get the results. Because remember, I'm not here to just treat patients. I'm here to get the results. And Relief Now Laser Methods gets you results. It grows your practice. It helps more patients. And we're doing it again without drugs and without surgery.
Last question, but why is this so much more important than the drug and surgical approach to do this first?
Well, if I was being blunt,
Please be
the,
blunt.
the drugs don't work. Drugs pacify the problem. The problem comes back. That there's a reason why you take two Tylenol every 6 hours. There's a reason why people go back and get another prescription because the first bottle didn't help.
So you're saying it masks it. It doesn't really get to the
So
root.
so there's so yeah, there's no resolve. It's like putting water on a forest fire. The fire is going to keep going.
Okay.
So if we're able to help, if we're able to create a solution, then we're doing the right thing. And as far as surgery, listen, surgery is not guaranteed. There's no surgeon in this country that would state, I guarantee this surgery is going to resolve your problem. So if
And
we're
the
able to get to
risks
the
involved.
Sure. So if we're able to get to, if we're able to get to that patient before all the medications, if we're able to get to the patient prior to surgery, we're going to get the results that we anticipate, and the patient's going to get the results that they want and what they're looking for. And that truthfully is the best thing that we could do.
I love it. I love everything that you're saying. And, if there's any patients out there in the South Florida area, Dr. Darren Kreitman practices at Relief Now Laser Plantation. The website is reliefnowlaserplantation.com. The phone number is 954-423-0020. I know he'd be happy to provide a consultation to you. And really, he lives health, he lives wellness, he wants that for you. I've known him for a very long time, and I know he has your best interest at heart.
Absolutely.
For the patients out there also that want to learn more about regenerative medical laser, you can subscribe to Relief Now Nation YouTube channel. We have a national network of doctors that is constantly uploading videos on all sorts of conditions, whether it's rotator cuff, tennis elbow, golfer's elbow, knee pain, plantar fasciitis, herniated discs, symptoms of peripheral neuropathy. It's all there and it keeps on growing. And I would have to say, Dr. Kreitman is on, part of a movement to really change the world. And I know there's even offices internationally under the Relief Now brand. So that's Relief Now Nation for today. And if you're ready to stop managing pain and start healing, visit reliefnowlaser.com to find a provider near you. Dr. Kreitman is reliefnowlaserplantation.com. I'm Dr. Robert Hannapol, and let's get you to ditch the drugs and skip the scalpel whenever possible. And we'll see you next time with additional podcasts of Relief Now Nation.
Ditch the drugs, skip the scalpel, relief now, feel it now, relief now, relief now, relief now, relief now, yeah, let's go.
Thanks for listening to Relief Now Nation. Ditch the drugs and skip the scalpel. Discover Relief Now at reliefnowlaser.com.